So first of all, Dr. Herman, thank you so much for joining us today.
Thank you so much for having me. It's a pleasure to be here.
So the Urgent Care Center at Peel Memorial for Integrated Health and Wellness will reopen to the public after it temporarily got closed in April 2020 to respond to the urgent demands of the pandemic. So tell us more about it.
Yes, of course. So obviously at Osler, delivering safe, high quality care is our top priority. So as I'm sure you know, the communities served by Osler were among the hardest hit by COVID in the province. So during the height of wave 3, we actually saw more COVID positive patients than any other hospital in the province, which caused quite significant capacity strain on our hospitals. So Osler had implemented a number of initiatives to support capacity relief during the height of the pandemic, which included temporarily closing our UCC, or our urgent care center, and also temporarily reducing our surgical services. So as you mentioned, the UCC did close in April 2020 in order for Osler to react to the urgent demands of the pandemic. So in addition, our volumes at that time had dropped dramatically at the UCC. So this allowed us to better shift the resources to meet the needs of the community to our hospitals. So then from September 2020 to April 2021, we operated the space as the COVID cough and flu clinic. And in this space, we were able to test, see, and treat patients who had cough, cold, flu, and COVID-like symptoms. So then again, during wave 3 with the capacity strains, we did close the UCC to once again shift our resources where they were most needed for the community. So now that the COVID hospitalizations and ICU rates have declined at Osler and in the province as well, we're now in a position to reopen our UCC, which, as you mentioned, we are very excited to announce will happen on Monday, December 6th. So as of Monday, our operating hours are 1 to 7:30, and that will be 7 days a week. And then come January 10th, 2020, we will be back to our pre-pandemic hours of 8 a.m. to 9 p.m., 7 days a week.
Mm-hmm. So is it different from the virtual urgent care center?
Yes. So the virtual urgent care center is a platform whereby patients can make their own appointments for issues that can wait up to a few hours to see a physician, and then they are then assessed online for these issues. So the UCC will be functioning as it did pre-pandemic, where patients will come to be assessed by our emergency trained physicians and staff. And our UCC is most appropriate for non-life-threatening and non-serious illnesses and injuries. So for sprains, strains, for broken bones, for coughs, colds, fevers in children 3 months and older, for allergic reactions, rashes, and ear, nose, and throat type issues.
Mm-hmm. So as you mentioned, people with these kind of conditions that you mentioned, only those kind of patients can use the UCC? So or are there any other conditions that can be treated at the urgent care center?
Of course. So basically any non-life-threatening, serious 911 type issue can present to the UCC, where we are more than capable of assessing these patients.
Mm-hmm. And talking further about the UCC, what about the appointments? How does the urgent care service work? How can people book the appointments?
So there's no need to book an appointment for our UCC. Similar to our emergency room, patients will come, they will triage, they will register, and they will then be assessed by one of our emergency physicians.
Mm-hmm. And what can someone expect to happen during their visit to the UCC?
So during your visit to the UCC, very similar to a visit to one of Osler's emergency rooms, you will first come where you will be assessed by one of our triage nurses, mm-hmm. and you have your chart made. You will be brought inside and you will be seen by one of our emerge physicians, depending on what the issue is and what treatments you require. We have full access to diagnostic imaging, to labs. So we will fully assess and treat the patients. Mm-hmm. Obviously, those patients who are more sick and require hospitalization will be transferred to one of our 2 hospital sites.
And will there be some interpreters available during their checkup if someone needs one?
So Osler does use an online interpreter service as well. We're usually quite fortunate in that many of our staff are able to translate for us, but we do have full access to an online translator service in real time.
Okay, and any other detail that you would like to share with us regarding UCC?
So I think it's just very important for people to know that as our volumes in the emergency rooms have returned to pre-pandemic level and probably will be steadily climbing throughout the holiday season, the UCC will definitely serve the need of the community in order to provide access to timely care. we would really encourage anyone who has these less life-threatening and serious conditions to utilize our UCC in order to be assessed by an emergency physician.
Mm-hmm. And doctor, as a physician, what tips you would like to give to people during this holiday season so that they can remain safe? And because the pandemic is very much here.
Of course. So, I mean, there's definitely many different things that we can do and know going into the holiday season and during the pandemic. So in terms of access to healthcare, knowing your family doctor or pediatrician's holiday hours and the hours of your COVID testing center is important. So obviously schedule any needed medical appointments before the holidays. And for those who have pre-existing medical issues that require ongoing treatment, discuss your care plan with your healthcare team so that you know how to access them and who you can reach over the holiday season that may be providing support. So obviously now more than ever, it's very important for us all to get our flu shot and ensure that your children's immunizations are up to date. As we all know, the flu and COVID have many similar symptoms that make them very hard to distinguish between the two. So by getting our flu shot, we can help to lower the rate of flu in our community and lower the rate of complications that may result in hospitalizations and a burden on our healthcare system.
Mm-hmm.
So other little tips like refill all your medication and medical supplies for you and your family going into the holiday season. And obviously it goes without saying that it's more important now than ever for us all to work together to keep each other safe. So following the public health guidelines in terms of wearing our masks, washing our hands, and keeping a safe physical distance definitely can help us all to stop the spread of COVID.
Yes, for sure. Thank you, Dr. Herman, for your valuable time. And I'm sure this information will help people in the community who are looking for urgent medical care.
Thank you so much. And we're very much looking forward to serving the community again starting this Monday. Thank you.
Thank you.